Hello, my name is Dr. Naran. I treat pain-related conditions with trigger point therapy and laser acupuncture. I have been doing this now for the last 10 years and have developed an expertise in treating soft tissue related pain, and I treat many conditions. From the head down, I treat headaches, migraines, neck pain, shoulder pain due to bursitis, rotator cuff, tendonitis, elbow pain due to tennis elbow, carpal tunnel syndrome. Going down the lower back, I treat arthritis, degenerative disc disease, hip problems, hip bursitis, hip osteoarthritis. Going down to the knees, sprains, strains, arthritis, and foot and ankle problems. I do this mainly by treating muscles. Now, why muscles? You've probably gone to your doctor already and they've given you these types of diagnosis, but sometimes muscles are the problem. And I've treated many people with this trigger point therapy to deactivate or calm the muscles down. And once the muscles are calmer in the joint, they relax and they move better. For example, the shoulder joint. The shoulder joint is made up of a whole lot of muscles that make it move. Now there's muscles here. Why can't they be the problem? So what I do is once I inject local anesthetic into those muscles, the muscles tend to release. Now what happens in all these muscles, they all develop strain points or called trigger points. And this is where the muscle has become knotted or tight. What I do is identify these points by palpating. Once I palpate it and once I feel it, I can find, because this point is a little sensitive, I then put a needle in there, and it's a quick in and out needle. Once I put a needle in there, I put a little bit of a local anesthetic as well at the same time. Now the mechanism of action is that the needle itself decreases or releases that knot, because this knot is highly electrically charged, and by putting a metal needle in there, it releases this knot. So it's the principle is very similar to acupuncture. But then what I do as an added thing is add local anesthetic. So what does the local anesthetic do? The local anesthetic decreases the nerve sensitivity, because what's happening is that this nerve is firing all the time because that muscle has become scarred and tight. And because the nerve is sensitive, it's become very prone. So even with a minimal injury, the nerve fires all the time. But what the local anesthetic does, it decreases that sensitivity and decreases sympathetic drive in that nerve. Now most of the time, you've probably heard of local anesthetic, and people have asked me, aren't you just freezing the muscle? In fact, this muscle is never frozen. The quantity I use is very minute, so you never actually feel frozen. Actually, the benefit comes by just desensitizing the nerve. Most people just need about 4 treatments to know whether this is good for you, and you should be at least 40% better in the 4 treatments. Then if you are, then you know that this treatment is right, and then you can do a few more treatments. Most people need about 6 to 10 treatments depending upon how long they've had their conditions for. But initially the treatments are done twice a week, and after that they're done on a weekly basis. Another frequently question is how long will this last for? And yes, it lasts for a long time. There's no such a thing as a maintenance therapy. Once you're better, then I don't needle you anymore, and then you discharge. If the pain does come back again at a later point, we can treat it again, but at that time it seems you just need less treatment than before. And it seems to desensitize or decrease the memory of that muscle. So there's really no maintenance therapy. But the beauty part of this treatment is that when it works well. So you'll know very quickly whether this is better or not. You've probably tried many modalities of treatment already so far: physiotherapy, massage therapy, chiropractic. But not everybody has treated the muscles. You've also gone to the physiotherapist sometimes, and some people may say to you, you just need to strengthen your muscles. But how can you strengthen injured muscles? These muscles have to become deactivated. Then only can you start strengthening them. So initially I say to rest after these treatments as well, at least for the first 2 weeks, because that allows the muscles a chance to recover. Once they recover, you can slowly rehab them and start moving them more and trying to go through the whole range of motion as well. But until you do that, you have to find a method of treatment that calms the muscles down first. A lot of people are frightened of needles, and they say, oh no, I don't really want needles. But my technique is a very simple technique. All I do is I go in and take the needle out. So it's a quick in and out. Also, how many needles would I use about in the shoulder? Probably about 4 to 6 needles, but a quick in and out just takes a few seconds to do. Most people in the past have said it barely feels like anything, maybe just a pinprick. So this is quite unlike any other treatments that you've had. If you have had something called IMS or intramuscular stimulation, this is very, very unlike that therapy. With intramuscular stimulations, they tend to pack away at the point, and that definitely is very, very painful. Again, with this needle, it's a quick in and out. Before you know it, it's all done. That seems to work well for most people. That has served me well, and has served many, many of the clients well. With this technique, I get good results, and patients are happy as well. And I really don't want to see you in any more pain that you are in already. The other thing is that, so why have you not heard about trigger points at all? This is like, where has this been? And this has been around since the 1960s. It was made famous by a physician called Jeanette Travell, and she wrote some definitive books on it. And these are the books she wrote on it. This is quite a thick volume, and it describes all the muscles. And what she did is she mapped out how muscles are affected and where the pain goes as well, called the pain radiation patterns. And this is somehow, this knowledge got lost, and only a few practitioners have decided to take it on. And then I found it about 10 years ago, and ever since then I've been doing it because I'm really, really happy with the results, and people are happy as well. But just most doctors don't know about it. So 99.9% of doctors don't even know that trigger point therapy exists. They don't really know the results of it. Some of you may have been referred to come and see me by your friends and family who have good success with it as well. That's how my practice has worked presently. It was mainly by word of mouth. So after your first treatment, what do you expect? For some people, they may be aggravated for the first 24 hours. Other than that, some people may feel better for a little while and it may slip back, or some people may not notice anything. But definitely overall, after 4 treatments, you will know whether this treatment is something that is of benefit to you or not. Thank you, and I hope to see you soon, and I hope that I can be of benefit to you and alleviate your pain.